All right, guys, I'm Dr. Hansen here at your local Maximize Living Health Center, San Antonio's premier total body wellness center. And today I'm going to talk to you a little bit about how we assess and treat our patients with neck pain. Really, neck pain is most commonly going to come from damaged or irritated nerves in the neck area and the cervical spine. That's what we see most commonly here in the clinic. Also, what research shows is going to be most common kind of throughout the nation as a whole. So when someone comes in with neck pain, we're going to go through a 5-step evaluation process. And the assessment, first thing we'll actually do is look at posture. Now, posture gives us quite a bit of information. So, for example, if we look here, 2 things in particular that we can check: the shoulders. So we can just have you face the camera. You can look at the shoulders to see if they are even. If you notice that one is maybe lower or one is maybe hunched up towards the ear, that gives us an idea in particular of strain right at the base of the neck, muscular tension, damage again to the neck or irritated nerves in that area. Also, if you turn to face that way, we look at the head posture. We want the head to be right over the shoulders. Many people's heads have shifted forward quite a bit, and what that's going to do is it's going to put a lot of compression right up at the very top, which will damage and irritate those nerves. Also, a lot of extra strain here at the base of the neck. The research shows really every inch or so that the head moves forward, it doubles in weight. So you can see how very quickly you're going to end up with neck pain if that posture isn't correct. From that point, you turn back and face the computer here. From that point, we'll actually look at range of motion. This is going to be to see how well things are moving, if joints are restricted, if there's spasm in certain areas. So, for example, lean your head, touch your left ear to your left shoulder. You'll see it doesn't really move very well, and then go to the other direction. Right, so a little better that way, but really not good either direction. And that gives us an idea of joints that are restricted, which would be irritating and damaging the nerves in that area, causing the neck pain. Also, potentially some spasm through that left shoulder there. From here, we'll move into our physical evaluation, and actually I'll have you take a seat here. And one of the main things that we'll do is actually get my hands in that area, and I'll be able to feel all the joints in particular, as well as the soft tissue, to see if there's spasm in certain areas. Also, she'll be able to notice if something's particularly tender, and a lot of times, we can really pinpoint exactly where that pain is coming from. So, with her, for example, kind of halfway down the neck, around the C4, C5 area, it definitely has some inflamed nerve roots there. So that would definitely be something causing neck pain. After we finish with the physical portion of the exam, really at that point, what I like to do is move into some instrumentation. One of my favorite diagnostic tools here in the clinic is our infrared thermal nerve scanner. This will allow me to actually scan that area. What I really like about that is it helps us start to differentiate what's really at the root of the problem. So a lot of times people are wondering, is it a spasm that's pulling the bones out of place and causing the damage, or are the bones out of place causing the damage and that's what's creating the spasm? Is there tension because of the pain, or is the pain causing the tension? The scan, if you notice here, will actually show us the areas that are damaged, if there's nerve involvement, how severe it is in relative area. That kind of finishes up what would be an initial evaluation, and we typically would move into any further diagnostics or testing necessary at that time. If need be, we can refer out for particular imaging, but we do our x-rays in-house. We have a very specific and precise way of setting those up so that we can actually see exactly what's going on in there, how long it's been there, if it's still correctable, and exactly how to do that, as well as important supplementary work with maybe exercises or stretches or therapies to make sure things are getting corrected and they're going to stay that way. X-rays also allow us to analyze to make sure that we can do the proper treatment, and putting all of this together, we can really make a custom approach to make sure we're getting to the cause of why your neck hurts, and address any damaged or irritated nerves and the soft tissue at the same time. People usually ask, okay, so kind of what happens after the evaluation? at a Maximize Living Health Center. And like I said, nothing is cookie cutter here, so we're going to be very unique to the individual. And the thorough analysis that we do really allows us to create a customized approach for everybody that comes in. But as we alleviate the damage or irritation of those nerves, that neck pain goes right away. And that's kind of how we approach things here at the Maximize Living Health Center. I'm Dr. Hansen, and I look forward to seeing how we can help anyone in the community with neck pain through our services.